Have you ever felt a numb ache in your knees when standing up from a chair, or experienced pain with every step on the stairs? If you're going through that, then this video is truly made for you. And number 7 in today's video might surprise you more than you think. You might have gotten used to putting up with the pain as a natural part of aging, but deep down, we still long for the day we can walk leisurely, without worry, without hesitation from aching knees. Age slows down cartilage. Regeneration, hormonal changes take place, and our joints become more fragile. Old daily habits, seemingly harmless, can gradually worsen the condition over the years. If we don't pay attention and care in time, knee osteoarthritis will silently take away our flexibility, significantly diminishing the joy in every small movement, from walking, getting into a vehicle, to simply standing in the kitchen to cook. But don't worry, there are still many safe, gentle methods to ease the pain, improve mobility, and restore joy in daily life. This video will guide you through 8+ simple but helpful approaches. And the last one might be something you've never considered. If you're over 60, leave a number 1 in the comments so we know you're following along with the channel. And if this content truly resonates with you, hit subscribe so you won't miss these gentle tips that just might change your entire day. 1. Weight loss, easing the burden on your knees. At a certain age, weight is no longer just about appearance. It becomes about each step you take, and the aching groans from your knees every time you rise from a chair, or when the weather changes. As time goes on, our bodies become more sensitive. Every extra kilogram doesn't just weigh on the scale, it weighs much heavier on every single joint. The knees bear the weight of the body in nearly all daily activities, from walking, standing, sitting down, to things that seem light, like cooking or taking the dog for a walk. When your weight exceeds the healthy limit, the pressure on your knees can be 2 to 3 times higher than normal. That means, just by losing 5 kilo, you could reduce up to 15 kilo of force on your knees every single day. This isn't an exaggeration. In a major U.S. study, it was discovered that losing just 5% of your body weight could reduce the risk of knee osteoarthritis by nearly 50%. It's like healing without medicine, without surgery, simply by quietly shedding a bit of burden that your body no longer needs to carry. However, losing weight in your golden years is different from when you were younger. You can't starve yourself or push your body too hard. What you need is patience and self-awareness. Eat more slowly and just a little less with each meal. Prioritize fiber, vegetables, fish, and white meat over red meat and animal fat. Stay hydrated and limit sweets, pastries, and alcohol. Engage in gentle movement daily, such as walking, yoga, or simply standing up and sitting down multiple times. There's no need to set overly ambitious goals. If you just lose 0.5 kilo per month, after 1 year, your knees will be carrying over 6 kilo less. That difference can significantly improve your quality of life. Less pain, better sleep, and greater ease of movement. Let weight loss not be a punishment, but a way to care for yourself. Start with a warm glass of water each morning, a meal with a few more steamed vegetables, and a slow walk under the early sunlight. Every gram you lose is a thank you note from your tired knees, and every lighter step brings you closer to the calm, peaceful life you truly deserve. 2. Exercise. Each step revives the joint cartilage. When you were younger, walking a few kilometers probably meant nothing. But after 60, if even standing up from a chair brings pain to your knees, then a single step can feel like a small battle. Many people, fearing pain, gradually stop moving. And ironically, it is that very stillness that stiffens the knees, wears down the cartilage, and invites sharper, more frequent pain. Exercise. It may sound simple, but for seniors, it is an art of listening to the body. It's not about moving more, but about moving correctly, rhythmically, and mindfully. Gentle, consistent exercise doesn't just strengthen the muscles surrounding the knee, it also improves blood circulation, boosts joint fluid secretion, and slows down degeneration. There's something fascinating. Cartilage has no blood vessels of its own, so it doesn't absorb nutrients like other tissues. It is nourished through movement, just like a sponge being squeezed and then soaking up fresh water. When you walk, stretch your knee or flex your leg. The joint fluid is pushed in and out, carrying nutrients. The life of cartilage depends on movement, so don't stop because of pain. Begin with the smallest steps. Each morning upon waking, don't jump out of bed. Massage your knees, rotate your ankles, do light stretches right on the bed. Walk for 10 minutes around the house, the yard, or the park. If you can't, go far, go near. If you can't go fast, go slow. But don't stay still. Light yoga, tai chi, slow cycling, or swimming are also excellent. They increase flexibility without stressing the joints. Most importantly, don't compare yourself to others. Some people can exercise for 30 minutes, others feel tired after 5. Your body doesn't need to be like anyone else's. It just needs you to listen and be patient with it. Exercising right is also a way to nourish the mind. A morning with a few stretches and deep breaths can leave you feeling calm and warm all day. And remember, what makes a difference isn't intensity, but consistency. One day, 1 week, then 1 month, and you'll begin to see your very own legs have started to heal themselves. You don't have to conquer a mountain. Just walk across your yard each morning, under the gentle sunlight, with the quiet belief that each step brings you closer to a life with less pain and more peace. 3. Nutrition. When food becomes therapy for the knees. Do you still remember the smell of warm rice and vegetable soup from childhood? Simple dishes that nourished so deeply. In old age, we often think we need medicine above all. But the truth is, daily food is the quietest yet most enduring remedy for our knees. Joint cartilage, that soft, delicate tissue, needs nourishment from within. After age 60, the body no longer produces enough collagen, and joint fluid gradually decreases. So nutrient-rich foods become especially vital. Omega-3, found in fatty fish like salmon and mackerel, flax seeds, and chia seeds, can help reduce joint inflammation. Calcium and vitamin D, found in eggs, mushrooms, and yogurt, help strengthen bones. Collagen and glucosamine, often found in bone broth or fish tendons, may support cartilage regeneration. Many elders say, "I'm used to eating like this. It's hard to change." But think simply. No need to overhaul everything. Just add 1 dish per week. For example, replace fatty meat with steamed fish, switch soda for warm ginger tea. Slow and steady. Also reduce fried foods, oily red meat, fast food, and sugar, as they are silent enemies of arthritis and obesity. And don't forget to drink enough water. Joints need lubrication too. Older people often forget to drink water because they don't feel thirsty, but the joints still need hydration daily. Meals are not just to survive, they are to heal. Let every bowl of rice, every spoonful of soup carry meaning, as nourishment for your knees, as gentleness for your soul. 4. Massage and warm compress. Listening to the body with gentle hands. Some days, your knees don't just ache. They feel stiff, cold, and even tender to the lightest touch. In moments like that, you don't need medicine. Just a warm, salt pouch or heated towel can soothe your spirit. It's not just about relieving pain. It's a gesture of loving care. Warm compresses improve blood circulation, help muscles around the knee relax, and reduce stiffness. The heat stimulates sensory receptors, which helps calm pain signals traveling to the brain. Just 15 to 20 minutes each evening, placing a warm pack or towel over your knee can bring deep relaxation. Some even enjoy soaking their feet in ginger, salt, or essential oils, letting the warmth spread through the body, promoting deeper sleep. And massage? Don't think it's only for professionals. Your own hands are enough. Gently stroke along the knee, make circular motions around the joint, lightly press on painful spots. That's all it takes to awaken the life within tired joints. You can use coconut oil, cajeput oil, or ginger oil, traditional remedies with soothing scents and anti-inflammatory properties. If possible, turn massage into a family ritual, where you and your loved ones care for each other not just with medicine, but with genuine connection and tenderness. Warmth, whether from your hand or a heat pack, may be just what your knee needs after a long, tiring day. Give your knee a chance to be loved, and you'll see, even pain can soften. 5. Knee braces. The quiet companion for every step. Many older adults hesitate to use knee braces, afraid they'll appear weak or become dependent. But in truth, the right brace can be a quiet friend, helping you walk more steadily, with less pain and more confidence each day. A knee brace won't cure osteoarthritis, but it helps stabilize the joint, relieve pressure on the damaged area, reduce pain, and support movement. Whether you're standing for long periods, shopping, walking, or climbing stairs, a brace shares the load with your knee, letting you enjoy daily activities without fearing sudden jolts of pain. There are various types of braces, from soft wraps to those with structured frames. Depending on the severity of your condition, a doctor or physical therapist can recommend the right one. The key is to wear it correctly. Not too tight to cause compression, not too loose to be ineffective. First, you can wear it during intense activity. Then gradually reduce use as muscles and tendons strengthen. Don't see a brace as a weakness. Think of it like a cane or glasses for aging eyes, used when needed and appreciated for its support. If you've ever felt afraid to leave the house because of knee pain, a brace might be the ticket. Back to life outside. A morning market stroll, an afternoon park walk, or simply wandering your garden in the sun. Sometimes strength doesn't come from force, but from knowing what you need to live safely and fully. 6. Pain relievers. When needed, let medicine be support, not dependence. There are days when, despite healthy eating, regular exercise, and nightly warm compresses, your knee pain still refuses to fade. That's when you may need help. And sometimes that help comes in the form of a small pill, modest, yet enough to lift you through a normal day. No one enjoys long-term medication, but for osteoarthritis, pain relievers can serve as a bridge, helping you get through flare-ups or stay mobile during key moments. Seniors are typically prescribed paracetamol, safe and low in side effects when used correctly. For stronger pain, doctors may combine with non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or meloxicam, though they require careful monitoring of liver, kidney, and stomach health. Some may think, "I'll just endure the pain. Taking pills will only make things worse." But the truth is, uncontrolled pain leads to less movement, poor sleep, emotional fatigue, and these are what worsen the condition. Using medication properly, under medical guidance, is not weakness but informed self-care. You don't have to take them forever. But during tough periods, the right medicine can help you preserve life's simple joys. Shopping, walking, cooking, small but precious moments. Key points. Do not self-medicate without a proper exam. Do not take drugs long-term without regular checkups. Do not use someone else's prescriptions. Let medication be a companion, not something to fear, because sometimes a timely pill can bring ease to your entire day. 7. Intra-articular injections. When support needs to come from within. If you've tried various methods but the knee pain continues to interfere with your life, disturb your sleep, and limit mobility. Then intra-articular injections may be worth considering. Two common types are corticosteroids, fast-acting, effective in reducing inflammation and swelling, especially in acute flare-ups. However, they should be used sparingly, typically no more than 3 to 4 times per year. Hyaluronic acid, HA, acts like a lubricant, helping the joint move more smoothly. Best suited for mild to moderate osteoarthritis, with effects that can last from several months to a year. Injections are not a replacement for other treatments, but an adjunctive step, helping reduce pain so you can continue exercising and rebuilding function. Many seniors report being able to walk more comfortably and sleep better after injections, which lifts their spirits and boosts overall wellness. Still, injections require a proper diagnosis and recommendation from a rheumatologist or orthopedic specialist based on imaging and physical evaluation. Think of the injection as a boost for your tired joint. Not a drastic procedure, but a gentle nudge to keep you going on the healing path. 8. Surgery. When it's time for a new beginning for your knees, there's a gentle but profound truth. Sometimes, to live fully again, we must bravely begin anew. For those with advanced knee osteoarthritis, where all conservative treatments have failed, joint replacement surgery may offer that fresh start. Partial or total knee replacement is now a common procedure, with increasingly modern, minimally invasive techniques. With proper rehabilitation, patients can regain normal walking, be pain-free, and reclaim a quality of life lost for years. Choosing surgery is never easy, especially for older adults. Worries about risks, recovery, and cost are all valid. But you don't have to decide alone. Listen to your doctor, your loved ones, and most importantly, your own intuition. What brings you peace of mind? Surgery is not for everyone. But if you've lost the ability to walk with your grandchild, shop in the morning market, or cook pain-free, regaining those may be worth more than anything. You don't need surgery because someone says so, but because you know in your heart you deserve to walk again, firmly and painlessly. Treating knee osteoarthritis is not just about medication, braces, or surgeries. It is a journey of patience, one small step at a time. Losing a few kilos, adding a wholesome dish, doing a few more minutes of movement each morning. Osteoarthritis doesn't knock us down in an instant, but it can slowly steal our freedom, our joy, and our confidence with every step we take. If we don't notice in time, there may come a day when even leaving the house feels like too much. But dear friend, it is never too late to begin again. The human body is miraculous in this way. It always waits for healing. All we have to do is start. All it takes is being gentler with yourself, slowing down a little, eating a little better, and listening a little more to your body each day. You'll see, these legs, which once felt weak, can begin to recover from the smallest, simplest things. You don't need to do anything grand. Just start with a breathing exercise, a warm glass of water, or a morning walk in the soft sunlight. One warm compress at night, one gentle massage. Sometimes that alone is enough to help you sleep deeply through the night. You don't need to live like you did in your youth. You just need to live as you are now, with more kindness and understanding. Growing older is not a burden. It is a precious time to choose to live more deeply, more slowly, and more clearly. If you've read or watched this far, I believe your heart is already longing for change. And I believe this too. You absolutely can. Let this video be a gentle reminder that you deserve to live without pain, to walk with steadiness, and to smile each day without worry. You deserve to live well, to live clearly, to live peacefully. If today's video touched your heart, please hit subscribe to Senior Compass, so each week we can meet again through soft-spoken words and quiet encouragement. And if you feel like sharing, leave a comment. Where will you begin your change? A small stretch? A meal that nourishes your joints? Or just one warm compress before bed tonight? We will read and treasure each and every note, just like old friends listening to one another over an afternoon cup of tea. And please remember, this, the most important message of the entire video. Beauty doesn't lie in age. It lies in how gently we care for ourselves each day.